Well, a warm welcome to today's talk. It's Saturday, the 10th of July. Now, a big debate has broken out in the UK about the so-called Freedom Day on the 19th of July. And this applies everywhere because it's talking about some pretty fundamental principles of the pandemic as it is now and the pandemic in relation to the Delta variant. So let's look at what this is based on. It's based on this paper here, just published in The Lancet a day or two ago. Mass infection is not an option. We must do more to protect our young. And the whole article is there if you want to check it out. And it's not a difficult read. It's not written in technical language at all, actually. Now, this has been picked up by 122, or written by 122 scientists, or agreed by 122 scientists. So I'm just going to play you the introduction here from the group, from their mass Skype call, and Professor Alice Roberts introduces it. So let's have a quick look at that now.
Hello everyone, and welcome to this emergency summit organised on behalf of 122 scientists from the UK and across the world. Today we've published a letter in the Lancet outlining grave concerns about the UK government's plans to end all restrictions on the 19th of July, even as cases are rising here exponentially. Sajid Javid, the Minister for Health, has said that he expects that we will soon see 100,000 cases a day. The scientists and doctors gathered here today have come together at extremely short notice to produce this letter, in which they say the government is undertaking a dangerous and unethical experiment. We'll be hearing first from a few of the scientists and then taking questions from the press, and also asking a number of MPs who've joined us to respond to what they've heard.
Now, of course, I have posted the link. You can watch the whole video, and it is well worth watching. We might listen to a little bit of that later on, but it does go on for well over an hour, interviewing a wide range of scientists. Now, just to put this in context, if we have a look at the UK at the moment, well, the vaccinations here we see are going well. Over 65% have had their second dose. Quite a few of those are still waiting for it to work, though. But if we look at the overall statistics here, we see that the cases are up in the week, of course, 30% increase. Deaths within 28 days of a positive diagnosis also up, although still thankfully relatively low numbers. Let's just have a look at some of the detail on this, actually, if we can. Let's go on to cases here. Something went wrong. We can't look at cases. Can we look at anything else? Can we look at healthcare? We can look at healthcare. So let's look at the healthcare situation. And we see that more people are being admitted to hospital. But that's a pretty sobering review, really, of the situation as cases escalate. Can we see cases now? We can see cases now. So there we see this great increase in cases, and scheduled to go on increasing really for the next few weeks because of the spread of the Delta variant. So that's the context of this. Now let's look at the argument of this paper, and it is a pretty interesting argument, it has to be said. So that's the title of the paper there. That's the government data site we've just looked at. That's the YouTube video we've just seen Alice Roberts on, and that's the link for this paper. And also this paper's link. Also, the other thing they put on here is the link to all the people that have signed it, as well as the authors. And there's 122 pretty eminent scientists on there that have signed this. So, given that these people have expressed concern, I think it's more than reasonable that we have a look at this. So implicit in this decision, that's the decision to reopen, is the acceptance that infections will surge. No question, infections are going to surge as a result of this reopening on the 19th and the Delta variant. Now, it's based on the idea that the government are saying that the vaccines have broken the link between infection and mortality. Largely true, so that gets a small tick. Largely true, but not entirely true. On the 19th of July 2021, almost all restrictions are set to end as we go into this great Freedom Day, as it's called. So that's going to happen. Now, to be fair, the Prime Minister is going to make a final call on this on Monday. All the rumblings so far from Sajid Javid and Boris Johnson have been that they want to go ahead with this. And we looked at this yesterday, that implicit in this seems to be a desire for herd immunity. Now, this is the counter-argument. We believe this decision is dangerous and premature, according to the authors. That is their view on that decision. Proportionate mitigations will be needed to avoid hundreds of thousands of new infections until many more are vaccinated. So basically they want to wait until more people are vaccinated. They say it's too early to do this. We have to wait for more vaccinations. Immunity will be achieved by vaccination for some people, but by natural infection for others, predominantly the young, if we go ahead with this current strategy. So yes, of course, we're still vaccinating as quickly as we can. But a lot of people are going to get the infection. Therefore, the hope is they'll get natural immunity, which of course is good as long as they don't get sick and don't get dying, don't get long COVID. In fact, infections can still be a cause of substantial morbidity in both acute and long-term illness. So the team here writing this paper don't seem so worried about deaths, although they will go up a bit. They're more worried about the morbidity, people getting sick, and the long-term illness. So acute means of recent onset. The converse of that is chronic, which is long-term illness. And of course, what they're thinking about here is the substantial risks that we have looked at of long COVID, which are not necessarily proportionate to the severity of the initial infection and the symptomatology of the initial infection. 5 main concerns about unmitigated transmission, and that really is what it will be after the 19th. I mean, there's no two ways about it. We are talking about going into unmitigated transmission in the UK, apart from the people that are vaccinated and have natural immunity. So first point they make, disproportionately affects unvaccinated children and young people. But of course, these are the ones that haven't yet been vaccinated. We're not vaccinating young people yet in the UK, or children. 17 million people with no protection against COVID-19. So that is a lot of people who can still get this infection, and it will cause this massive extra spike that we have been predicting on this channel for some days now. That one, that you no doubt remember, cases going up to 100,000 cases by the 19th of July per day, and then possibly even going beyond that. Basically unmitigated spread, as this paper has said in quite stark language, really. So exponential growth will probably continue until millions more are infected. Millions more will get infected with this strategy, leaving hundreds of thousands of people with long-term illness and disability, they say. Now, we don't know this, of course, but 20-year-olds, it looks like about 1.2% get long COVID. Middle-aged, it looks like about 4.7% get long COVID based on the COVID symptom tracker data. They fear it could be higher than that. And these are 122 scientists, so if they have a fear it could be higher than that, then I think we should also seriously consider the possibility it could be higher than that, going up to 5 towards 10%. Risks creating a generation left with chronic health problems and disabilities. Pretty stark warnings here, pretty stark language, it has to be said. Risk creating a generation left with chronic health problems and disabilities. I mean, this is not entirely. I mean, remember when I was young, some of the big kids at school, they had polio form deformities because there was a big outbreak of polio in 1955. So this could happen, and there was a lot of problems after the influenza pandemic way back in the 1918-19 as well. So post-viral complications we know well, and of course we saw Vlad talking very eloquently and clearly about his post-viral, or we assume post-viral, chronic fatigue condition. Risk. So that's the risk. Second, so I agree that this is a risk. We can't really quantify that risk, but is it definitely a risk? Second, transmission in schools will lead to educational disruption. Now, I must say, this doesn't worry me particularly. Strict mitigation in schools and eventual vaccination of children. So they're talking about vaccination of children. Now, what I mean by this one doesn't bother me so much is education can be caught up on. There's no reason to say that you have to get a particular level in education by a particular time. I think that's a bit of a Yeah, I think you'll learn things when you want to learn them, basically, would be my contention. But anyway, that's what they're saying. I'm reporting what this group is saying. More important for clinically and socially vulnerable children. Well, I agree with that 100%, of course. So children that are more clinically vulnerable, children that perhaps have immune difficulties, maybe not responded to the vaccine. So third point, emergence of vaccine-resistant variants, spread of potentially more transmissible escape variants that escape the immune system. Now, what they mean here is, of course, this virus is constantly evolving, but things evolve and there's a change in gene frequency in the viral population because there's a selection pressure. Now, so far, that selection pressure has largely been what is the most transmissible form. So the reason we have the Delta variant now is it has outcompeted the other variants of the virus because it's more contagious. Therefore, it's outcompeted them. So there's been more of it and it's spread quicker. But as more and more people are vaccinated, then the form of vaccine that will thrive in the community, of course, if a lot of people are vaccinated, then a vaccine-resistant strain can't thrive. By definition, the infection that's going to infect people who are vaccinated are those that the vaccine is not covering. So this is a vaccine selection pressure. So the vaccine is making the environment hostile for particular variants, but that leaves the door open for other variants. Those variants will then proliferate, and of course they can only proliferate if they are vaccine resistant. Otherwise they wouldn't proliferate. But if the vaccine resistant forms proliferate, transmit, then you'll get the emergence of these vaccine resistant variants. So the vaccines themselves, acting as a form of natural selection, could change the viral type, meaning by definition the type of viruses that emerge are more likely to be immune escape vaccine resistant variants. Fourth, a significant impact on health services and exhausted healthcare staff. Links between cases and hospital admission has not been broken. So it's been weakened but not broken. So I think we can agree with that. Weakened but not broken. Rising case numbers will inevitably lead to increased hospital transmissions. Now, we know that young people, the proportion needing hospitalisations are less, but it's not nothing. And we did hear from Dr. Nigel Farrier in Australia, who reported on quite a few under 35s being in intensive care at the moment in Sydney. Delta variant, of course, so I was really quite concerned to hear that. Millions of people are waiting for medical procedures and routine care. Again, another very strong point, that the collateral damage, what an appalling term, a military term, I suppose, really, but the collateral damage to this pandemic has been people who haven't had the cancers diagnosed, people who haven't had the varicose veins fixed, people who haven't been able to get elective surgery, people in chronic pain from osteoarthritis because they can't get their hip operations or their knee operations. So many things like that. And of course, the more people that are admitted with COVID-19, the more there's going to be this delay. And there's millions of people waiting for care in the UK at the moment. This is a big problem. Make no mistake, people are dying at the moment because they can't access the healthcare that they need at the time that they need it. This is going to lead to more deaths from heart disease, more deaths from cancer. So a very, very valid point. Fifth, deprived communities are more exposed, disproportionately affects the most vulnerable and marginalised. They fear. This is why it's so important that these communities come up to speed with vaccination, but they point out this risk and it is there. So 5 pretty good reasons, really. In the light of these grave risks, they say, given that vaccination offers the prospect of quickly reaching the same goal of population immunity. So they're saying that we don't need to go for a herd immunity strategy because pretty soon the vaccinations will catch up. We're vaccinating at a rapid rate. So we don't need to do this. So Sajid Javid is saying that, well, by wintertime, we don't want to be releasing restrictions in wintertime and have spread in wintertime. But by wintertime, we've got we've got July, August, September. We've got another 3 full months to increase herd immunity massively by vaccination, not by people getting the infection. So I can certainly understand where this letter is coming from. It's making a lot of sense. given that vaccinations offer the perspective of quickly means a few months, reaching the same goal of population or herd immunity, saving the necessity for natural infection, and this group clearly assuming that adolescents and children will be vaccinated in the near future. We consider any strategy that tolerates high levels of infection to be both unethical and illogical. So they're saying it's not ethical, and basically they're saying it's not good science, it's not good medicine. That is what they're saying. The UK government must reconsider its current strategy and take urgent steps to protect the public, including children, is what this group are saying. We believe the government is embarked on a dangerous and unethical experiment. Now, we actually kind of made that term up, didn't we? About a week ago, we called it the UK, what could only be called the UK experiment. And there's no two ways about it. This mass release with mass infection, which there will be absolutely mass infection, is an experiment. It is an experiment. We don't know. Sajid Javid said to paraphrase him, he said there's quite a few unknowns in this. It reminds me of Donald Rumsfeld saying there's known unknowns and there's unknown unknowns. So in this, there's known unknown. Well, there's known knowns in this. We know people are going to get more infection. There's known unknowns. That's the degree of people that are going to get long COVID as a result of this. We know some will, but we don't know exactly how many. And who knows, there might be unknowns, things we don't know about that we don't know about. So it is an element of risk. Right. Instead, this group are saying, delay complete reopening until everyone, including adolescents, have been offered vaccination and uptake is high. So they want to go via the vaccination route. They want mitigation measures, especially adequate ventilation, which of course we've been going on and on this channel about for at least a year now. It's still rubbish in a lot of places. And they're also suggesting, this group, that we use CO2 monitors, because if CO2 is rising, that is indicating that there is a lot of exhaled air in the room. And of course, the exhaled air is where the virus particles would be if if there are people that are infected. And this group are talking about many mass transmission events, mass spreader events. So I agree with that. CO2 monitors and air filtration devices, absolutely, we need those. And of course, ventilation, it's so basic, it's so simple. This is primarily an airborne virus. Spacing in schools, of course. So they particularly want to protect children here with universal mask wearing indoor spaces, even for those vaccinated. So as I've said, I will do after the 19th. This will ensure that everyone is protected and make it much less likely that we will need further restrictions or lockdowns in the autumn. Well, I think Sajid Javid's whole point is that we won't need anything in the autumn, because by that time, everyone will either have been vaccinated or will be immune. So his hope is that will be it. We'll reach herd immunity by the start of next winter. That seems to be his undeclared aim. Look, if I'm wrong, Sajid Javid's welcome to come on the channel and correct me, of course. We'll be delighted to have him if I've got that wrong. But that's the way I'm reading it between the lines at the moment. So that is the debate in the UK at the moment. The politicians will make their final decision on Monday, Saturday today. Interesting to see which way they'll jump. But all the mood music so far is that they're going to carry on with this opening up at that time. So I think I'll just play the next speaker here briefly, and then we'll finish this video.
And we're also hoping to bring in some members of the public as well, and some other groups. So thank you all for joining us. And first, we're going to start with some brief remarks from Professor Trish Greenhalgh, Professor of Primary Care Health Sciences at the University of Cambridge, who is going to explain the letter and also why this group has come together today. Thank you, Trish. Over to you.
Thanks very much, Alice. Actually, I'm from Oxford, but I'll forgive you for that. Yeah, as you say, we've called this summit to express our concerns as both scientists and doctors about these plans to roll back almost all mandatory measures to control the spread of COVID-19 from the 19th of July, what's being called Freedom Day. Now, some of the things I'm most concerned about include the abolition of mandatory masking in public places, the abolition of physical distancing, the removal of crowd controls in places like pubs and cinemas and stadiums, and more generally, this encouragement to go about our lives as if the pandemic were over. And as Alice has said, it's not over. The UK currently has the 4th highest number of daily cases in the entire world. We are up there with Brazil, with India, with Indonesia. Yes, many people in the UK are now vaccinated. Yes, the link between infection and serious illness has been weakened, but no, that link has not been broken. There's currently hundreds of people in hospital, and some of those are vaccinated people. And let's remember that half the entire population of the UK, 1/3 of adults in the UK are not yet fully vaccinated. So these vaccination figures are going to rise. The campaign's still going on. So why the rush to open up before many of us are protected? Now, we need to factor in the mechanism by which COVID-19 spreads. There's now strong scientific evidence that this happens mainly through the air. Little tiny particles containing the virus get exhaled by one person and then they get inhaled by other people. And this happens mostly, as you'd expect, when people are in close contact. So when you're close enough to smell the garlic on someone's breath, that means you are breathing in air that has just been in their mouth and their nose. The more time people spend indoors, the more of these infectious particles are going to accumulate, and they will eventually spread throughout a whole room, infecting people even beyond 2 meters. Just a tiny word on masks. They're not 100% effective at stopping the virus, but if you're wearing a good, well-fitting mask, that will filter out between 60 and 90% of these viral particles. And that means that if you're wearing a mask and I'm wearing a mask, we're both doubly protected. So all this means that the best way to reduce the transmission of this virus is first, spend as little time as possible indoors sharing air with people. Second, if you must put people together indoors, keep them 2 meters apart. Thirdly, make sure that people indoors are wearing well-fitting masks. And fourthly, make sure those indoor spaces are well ventilated and that that the air is filtered. Now, let's just go back to Freedom Day before I hand back. The best way to increase transmission of COVID-19 would be to abolish physical distancing rules, to abandon the wearing of masks in indoor spaces such as offices, factories, school classrooms, cinemas, shops, public transport, and also to encourage people to gather indoors in under-ventilated spaces for prolonged periods of time. In other words, this new government policy seems designed to increase cases. Now, what I predict is going to happen is we are going to get hundreds of super spreader events caused by people gathering unmasked in indoor spaces. And we know that these super spreader events are the main driver of this pandemic. So let me hand back to the chair, and I hope I persuaded you that this isn't a very good policy.
Thank you very much. So that was Professor Trish Greenhalgh from Oxford University. And now we're going to hear a few words.
So that goes on for an hour and a half or so, as I've said, and interesting. That professor there, Trish, was saying it's almost as if this is designed to increase cases. So this is interesting. Well, I think I'm convinced. I think this excessive opening up is probably not the best thing to do, and I think the arguments put forward by this paper are pretty convincing. And of course, if either Professor Alice or Trish would like to come on this video, they would be more than welcome. So here we go. Which way is it going to go? And of course, these things apply everywhere. Of course, in the United States, we're in a similar situation now where Delta is taking off greatly. In fact, pretty well every country in the world. Well, every country in the world, Delta is pretty well every country in the world. Delta is increasing. Europe, Indonesia, Vietnam, Thailand, African countries, some of the places we've highlighted lately. So this is going to be an ongoing concern for some time. Certainly wearing masks, it doesn't cost anything, does it? Why not do it? unless, of course, you're deliberately going for a mass infection and a herd immunity strategy. Right, we will obviously be watching this with great interest. Thank you for watching this video.